For decades now, the acronym RICE, R-I-C-E, has been commonly recommended for most acute injuries. RICE stands for rest, ice, compress, and elevate. For instance, let's say you sprain your ankle. Under the rules of RICE, you would rest or get off of your foot, wrap it in ice tightly, and raise it up so that the swelling can come out of the ankle. This sounds good, and for years it's been highly recommended by athletic trainers, doctors, physical therapists, and even weekend warriors. But is there really any evidence that supports this practice? Well, believe it or not, the answer is no. Now, I can hear all the objections already coming up to the surface. You just said it's been used for years. Everyone knows RICE. What's the problem? Well, to better answer that question, we have to understand a few foundational principles. One, what does ice do for injuries? And two, how does it help the body heal itself? See, ice as a modality is pretty well known, but not very well understood. How exactly does it work? It slows down blood flow to an area, and it also slows down the metabolic rate to that area, which means it slows down and reduces the oxygen demand that the tissues need. That's the idea behind using it. If you don't have as much blood going to an area, it slows down the throbbing and the pain. However, to really understand why this is a problem, you have to understand the phases of healing too. So for typical healing in the body of any injury, there's 3 phases of healing. And we don't have to go into all the details. All you really need to know is what the first stage is, which is inflammation. Now that might seem a little confusing because inflammation is typically seen as a bad thing, but in all actuality, it's really the body's first line of defense against an injury. Think of it as kind of your body's 911 response to a problem. Your body recognizes the injury and sends a rush of blood to the area to flood the site with various blood cells, platelets, white blood cells, and other things to help with the repair. This increase in blood flow, or 911 response to the injury, results in what we call swelling, also known as inflammation. As the injury is repaired, it becomes the lymphatic system's job to remove the old, used-up repair cells and get rid of the inflammation over time. It gets help from the contraction and the relaxation of the nearby muscles, which compresses the lymph nodes and helps pump away the extra fluid. So now let's integrate our analogy with our example. You've just rolled your ankle. It hurts, and your body initiates its 911 response by beginning the flow of blood to the area. Now, under the RICE principle, we would stop moving and put ice on it, meaning the ice will slow down the blood flow or really impair the body's natural 911 response from getting to the site where it's most needed. It would be a lot like getting in a car accident and dialing 911, but then having someone come behind you and place down a lot of roadblocks and stop the EMS from being able to get to you to help you out. Why would you ever want that to happen? To make matters worse, you're resting the ankle, which means the nearby muscles can't help the lymph nodes move out the swelling and old repair cells when they're no longer needed in the area. Is the temporary decrease in pain really worth it? Now I know this is a lot to take in, and this is something that's been so ubiquitous and so well known throughout the world that it's kind of hard to think, why would I ever stop? It's always worked, right? And I understand that there are a lot of people that still won't be convinced. But here are 2 more pieces of evidence that I think could help put the nail in the coffin of ice. A 2012 systematic review of the RICE principle in ankle sprains attempted an analysis of the existent data. The results were mixed at best. Multiple studies found absolutely no difference between the icing group and the control group, which are groups that didn't receive any treatment. 2 studies, which did support the use of ice, didn't compare ice to a control group, but to the use of heat instead. Later, in 2014, Dr. Gabe Merkin, MD, the inventor of the RICE acronym, recanted its use, and he stated anything that reduces inflammation also delays healing, and noted that ice also reduces strength, speed, endurance, and coordination. So what do you think? I hope this post was informative and gives you a new outlook on the R.I.C.E method. Feel free to comment and leave your thoughts below.